Hello, dear casuals. This is Immanuel Tolstoyevsky, and our guest today is Dr. Tanya Elliott, a nationally recognized telemedicine expert. We talked about the recently accelerated evolution of the digital health space and the biggest opportunities and misconceptions associated with it. And also a special thanks to Switch and Board, who organized this interview. Hope you enjoy it. You are at the intersection, kind of an intersection between allergies, immunology, and telemedicine. Does that sound right?
More just general medical care and telemedicine and technology. My specialty, what I trained in, is allergy and immunology. So that's sort of my day job. But when it comes to telemedicine and healthcare technologies, it spans all forms of healthcare. So heart disease, diabetes, allergies, also general primary care, all the different use cases for medicine in general, and how we can leverage technology to improve care.
How long have you been involved in telemedicine and virtual healthcare?
Since early 2014, January 2014, I joined a company called Doctor on Demand, which was the first video-only nationwide medical practice. And this model was more of a virtual urgent care model. So if you have a cold, the flu, a rash, runny nose, maybe a bruise or a bump, or you just needed a refill on a medication, you could use this platform. You download an app, you press a button, the doctor pops up on the other side of the screen. I was that doctor on the other side of the screen. And then we would make a diagnosis and then send a prescription to the pharmacy if you needed it. And after seeing a number of patients on my own on the platform, I got more involved on the business side, became their medical director, started bringing on more and more doctors and training them on how to actually deliver care this way, because it's different than when you're just in a traditional doctor's office setting. You have to adjust things, obviously, when you're not physically in the same room as the patient. Part of the other piece of what I did was get patients and people to change their behavior and say, hey, you don't have to sit in a waiting room for 2 hours. You could actually click a button and connect and interact with the doctor in this different kind of way. And then at the same time, getting the doctors trained on it, because it's a different skill. For example, making eye contact. I'm making eye contact with you by looking at the camera, but that's not looking directly at you. So all of these various skills so that you can convey building rapport and compassion, and that you're listening attentively and actively, all of that we learned in the office setting has to now be translated into a video setting so that the patient feels comfortable with that doctor-patient relationship. So a lot of the training went into that. And then the other piece of the training went into, okay, what's appropriate to treat? What's not appropriate to treat? When does this person need to go in person? How does this exactly work? And so it's kind of a different skill set than when you're physically in the office. You grab your nurse to come in, you draw the blood work. There are just different things that you need to do and different technologies you need to embrace in order to be able to deliver care this way.
Right. It's almost like a combination of medicine and psychology, because you have to really reprogram people, both the patients and the doctors. So did you have to educate yourself on this psychology, or you kind of have had a feel for it?
I had a feel for it, and a lot of it was because I had done television and media work before, so that your movements are much bigger through video. So if you go like this to your patient, you're going to scare them a little bit. So all of these things, these skills that you need to hone, that I actually honed because I was doing a lot of media and television, I needed to teach doctors a little bit of that skill set so that they could identify best with. It was really about making patients feel comfortable with the technology that it's just very different. And we're creatures of habit. So we were just very much used to interacting with our doctor in a certain way. And it was a very formal relationship. And so you need to kind of recreate all of that. And it's everything from the eye contact piece that I just described, to doctors wearing their white coat, to having a professional background, all of these things that are just new skill sets that doctors need to take on. As I'm talking to the patient, every now and then I do a face check and look at myself in the camera. And say, okay, am I making a scowl? Am I making an upset face? Am I too close to the camera? All of these things. So I got really good at it over time, because something that may seem perfectly normal in my head might be appearing very different on camera. Especially me, I have to watch my facial expressions. I get big, really excited, and can talk like this, and it could be a little scary to the patient. So I actually learned and used the psychology, the feedback loop of seeing myself in video, and that's actually how I got better at it during the actual visit, which was kind of neat.
And I guess this is applicable to all the doctors. I mean, they could really apply this lesson that they learned from you.
And not just doctors. Not just doctors. Now that we move to virtual meetings, even CEOs and executives and other professionals, to be able to make sure that they, there's one thing to have a commanding presence and command the room when everybody's sitting there with you. There's something that non-palpable about that, or perhaps palpable about it when everybody's in the room together. How do you then translate that passion when everybody's on a Zoom call? So I think it's almost a crash course in how to communicate effectively through this modality. I just so happen to come at it as a doctor, but lots of the skills and the things that I teach are applicable for everybody who's now, doing Zoom, interacting with friends and family members, and they want to make sure that they're conveying that emotion that is oftentimes easier to do when you're physically in the same room as somebody.
Well, do you feel like now that everybody is doing Zoom for everything, out of necessity, do you feel a bit frustrated that, hey, I was doing this before, I was doing this when it was not popular? Or are you happy now that it's catching on?
I'm very happy, because it was something that I said, wow, I waste 90% of my time and energy just trying to convince people that this is a great modality and a great way to deliver medical care and a great way to communicate and foster relationships, whether it's doctor-patient relationship or with your employees or what have you. And so now I don't have to waste that time trying to convince people. Now they're like, great, tell me how to do it. Tell me how to be the best at it, how to be the most effective. So now is where it gets really fun and we start to get creative. How does this change healthcare for the future? Let's sort of put away that traditional office setting and say, okay, this is the new normal. Let's think about all the new and exciting things that we can do. And how can we, again, leverage the technology to improve access to care, to remove barriers to care, to improve doctors' workflows, to have a kind of one-touch healthcare experience for patients. So this is where I've, been so passionate about, and before maybe couldn't get people to listen. And now that people are actually listening, I have some great minds with me in the room saying, wow, these are all the amazing things that we can do. So it's a really exciting time.
We've never talked about telemedicine or the definition of it, and I'm not going to ask you to define it. Anybody can go and check it on Wikipedia. But maybe you could tell us, in your experience, what has been the biggest misconception about telemedicine?
Yeah, the biggest thing was that, and you kind of said it in the beginning, is, your doctor can now bring you onto this platform and you can continue your relationship with the patient. But this notion that you cannot form a doctor-patient relationship through video, that's probably the biggest one. Or just through telemedicine. Oh, there's no way, I need to somehow be in the same room as them, and then magically we have a better relationship than we could ever have if we met through video. If you think of the world of online dating, we know that that's not the case, right? So why hasn't healthcare evolved? So you can develop a meaningful, impactful relationship, doctor-patient relationship, through this modality. You don't have to physically get in your car, drive, sit in a waiting room, fill out a bunch of forms, get called in by the nurse. Those things are not required in order to have a relationship with your doctor. And not only that, I feel like this modality where I'm the doctor, you're the patient, I'm looking directly in your eye, I have to listen to everything you say very intently and in very detail, because I don't have my hands to physically put on you to do the physical exam. So I really have to focus on that history, that we can almost develop an even better relationship this way. I could see in your home, I could potentially identify things that might be contributing to your care. I could talk about things that might be beneficial. Oh, look, you have a window back there. Maybe you should take a walk outside. It looks like you have a pretty view. So all these things, I actually learn a lot more about my patients interacting with them through this modality. And so that's something that I want people to understand, that the way that we typically interacted with our doctors, forget about that. This is now the new normal, and it could be a very meaningful doctor-patient relationship. And then the other piece is that, oh, well, how are you going to examine me, or how are you going to make a diagnosis? Here's the facts. 90% of the decisions that doctors make are based off of what you tell me, your history. This is how long this has been going on. This is exactly what's happening. This is what made it better. This is what made it worse. Then there's 10% that's based off of the, quote, physical examination. Most doctors focus on observation. Do you look sick, right? Do you look sweaty? Do you look pale? Do you look flushed? All of these things I can do through video. I can examine your skin through video. I could ask you to open your mouth and stick out your tongue and look in the back of your throat through video. I can look at your musculoskeletal exam, look at your hands, making sure you're making good fit, all sorts of things. So the notion that you can't make a diagnosis through video, or that you're very limited in diagnosis, that's not true either. And the stethoscope is really the one thing that we can't do through video unless you have a digital stethoscope, which now they are available. But the stethoscope changes my management, my treatment of you very, very little. If I'm concerned about your breathing, I'm probably going to send you for a breathing test or an x-ray anyway. And I would say 9 out of the 10 reasons patients go and see a doctor, with the exception of a broken bone or stitches, can be diagnosed through video consultation and telemedicine visit. Even without the stethoscope, even without that stuff, I tell my patients, you're going to be my hands for me. So in the office, I would tap on their sinuses say, hey, do you have any pain when I do this to you? So the only difference is you're my hands for me. You're going to tap and you're going to tell me if there's pain. And for the abdominal exam, the belly exam, it's going to be the same thing. You're going to be my hands for me. You're going to push here and here. And I would challenge everybody to think about the last time they went to the doctor and what exactly that physical exam was. Like I said, everyone always thinks about the stethoscope, but that's not the only thing that doctors do. And for the most part, they say, oh, stand up, sit down, lift your leg, do this. And then they're watching you. It's all about the art of observation. And then us taking that information as providers and saying, okay, now how am I going to incorporate that information that I just got from you into the rest of the picture, into the rest of what this patient has told me?
So if this is the case, if really a very large percentage of all the decisions could be made this way, why did it take so long for telemedicine to be mainstream? It's actually, we could probably say it's not mainstream yet, but it's going there at least. What was the biggest obstacle? Was it the technology, or patient habits, or more regulatory stuff? Maybe insurance dealings, the doctors and insurance, they couldn't figure it out somehow?
Yeah, I think it's a combination of all of those things. One is that we're creatures of habit. And so patients who've never done telemedicine before are like, no, I have to go to the doctor's office. That's just how it is. That's like when, banks came out with ATM branches where you just do the ATM and you don't have to go to the bank teller. And people are like, oh, no, I'm going to go to the bank teller anyway. I have to go. There's no other way to do this. I have to hand them my money and then they have to give me the money back. So you just can't think about something that has never existed before. So that's a big shift. It's just a behavior change shift. And that was on the part of the doctor and on the part of the patient. Reimbursement was another big thing. Doctors are like, if I'm not going to figure out how to get paid for it, I'm not going to waste my time doing it because I want to just make sure that I get paid. So the reimbursement piece was a big thing. And then technology would be the third thing. And, in the United States, we have electronic medical records where we made this requirement for all doctors to go on to an electronic medical record. And they are very, very cumbersome. They take up a lot of time and they contribute to physician burnout. Doctors do not like to have to interact on the computer. And what oftentimes happens in the office is they're facing their computer and they're turning and typing this way, and then they're not even looking at the patient. So it's really taken away from the doctor-patient relationship. And it just has become more, all these pop-ups and things, and it's become really challenging. So doctors were very averse to doing any new technologies. And then on the part of the patient, there was a conception, a sense that, an older patient won't want to do this. They won't want to use their smartphone. They it's too complicated or complex for them. And actually, even before COVID, what we found was that that wasn't the case. And if you think about it, lots of people over the age of 50, 60, they're, they're maybe going on dating sites, or they're doing FaceTime with their friends or family members. So, a lot of the work I've done is saying, hey, you actually use this technology a lot without even thinking about it. So why wouldn't you want to use this technology to interact with your doctor? So the technology barrier on the part of the patient was less than the technology barrier on the part of the doctor, who said, no, do not give me another piece of technology that I have to fight with, especially if you're not paying me for it.
It's actually kind of crazy that when you said a lot of doctors' time is spent on these electronic records, maintaining them. When I think of this technology, it is quite easy probably to merge it with speech recognition or image recognition, so those records could auto-populate.
Yes, and that's going to be the next phase of healthcare. But when you say that now, even to doctors, even though now they're accepting of the video technology and capability, it's like, oh, what do you mean artificial intelligence? And that's just going to that's going to destroy our business and all this stuff. So there's going to be a new generation of doctors that will be embracing this, because it's going to be taught in medical school curriculum. It's just all of this is going to change the face of healthcare. This is actually what we're doing right now, interacting through video. This is the tip of the iceberg. And then just to your point, which makes logical sense for you because you're not in the healthcare field, and you're like, yeah, this is like, I'm a tech person, I'm an engineer, like this is amazing. We'll take a new generation of doctors to adopt, because the data sets and the way that they interact with patients and the types of information that they're going to receive from patients is going to be different. And that's the training that needs to take place. Like, a doctor that's been in practice for 30 years, if it's like, oh, now you can use facial recognition to do X, Y, Z and diagnose this mole, they're going to be like, no. I have to go to the textbook. I have to read this, look this up, and then I have to send this to the lab at the pathologist. And so it really is going to take a whole new generation of training before I think it adopts. But generation as in people that are in medical school now, people who are applying to medical school. And that's why anybody who says to me, oh, should I become a doctor? Yeah, because now it's going to be really exciting, and it's very different from what you see currently being practiced today.
Now I want to shift to the patient side of things, because a couple of the things you said really resonated with me. I watched as my homework some of your videos where you were teaching people how to do self-examinations, right? So my question is this: do you see the fact that the patients have to be your hand in a way is sort of an obstacle because you have to teach them, you spend a lot of time training them, or this is actually worthwhile because it's the best opportunity to educate people, making your job easier in a way? So is this more of an obstacle or an opportunity?
I think it is more of an opportunity. We have not done a really good job at teaching patients or talking to patients about what we're doing. And this is one of my biggest issues with medical school, that I said I spent 4 years learning a whole new vocabulary so that I could confuse people. I want to be able to talk to people in a way that they understand. And I think telemedicine forces you to do that. And my goal is to keep you at home healthy and give you all the tools you need to stay healthy every day. I don't want you coming into my office. That means there's a problem. For me, it's I did something, what did I do wrong that this patient now has to come in? I want to equip you with all the tools and information and everything that you need to stay home and stay healthy. And so it's really important, I think, for people to understand when I do this, I'm tapping on your sinuses. If you have pain here, that's concerning. That's when you need to contact me. Well, great. Now, next time we could save a visit. Oh, I tap here near. Oh, I don't actually have pain. Maybe it isn't a sinus infection. Well, that just saved me a doctor's visit. And that's truly relationship-centered care. It requires both the patient and the doctor buying in. Patient-centered care, which is what we were previously calling it, a little bit too much the patient calling the shots. Oh, I need to see a dermatologist for this. Oh, I need to see an orthopedic surgeon for this. Oh, you know what, that actually leads to you perhaps that self-diagnosing and going down the wrong path. And so the real care, the way to deliver care effectively is relationship-centered, where the two of you are working together. It's, hey, I'm starting you with this knowledge and information. Here's what you need to do with it. And you come back to me and say, oh, hey, I noticed this, this, and this. And it's just a much more robust, interactive relationship. And if it means that there's a couple of people that are a little over worried or overzealous, is it this, is it that, maybe that, you know, maybe initially, but then we'll work together to figure out what's fact and what's fiction. And I think that that was a concern. Will this lead to overutilization of the healthcare system, overutilization of services? Are we sharing too much with our patients? No, I think that that's a little silly. I think we need to give people the benefit of the doubt that if we're equipping them with the tools, they're going to interact appropriately in the right ways to do that.
Yeah, and now actually my engineering again mind is working, and I'm thinking when you're diagnosing a patient over the camera, it would be quite easy to overlay certain information for you. You could really remember their birthdays or the story that they told you about, some specifics about their lifestyle, and ask about that, and that would help me feel like, oh, okay, this doctor really cares about me, knows a lot about me, tracks all that stuff.
The other thing, just with like the data, the amounts of data that we have, where it's going to be amazing the way that we can now equip doctors with better information and real-time data to help make better decisions. And then also equipping patients with this information. There's so many different ways we can harness technology to improve patient care and patient outcomes. And, you know, we have to sort of suspend our beliefs around, oh, data getting into the wrong hands. Like, this is for the advancement of healthcare and the you know, and longevity and people's overall health and well-being. The information that we have today is so spotty. If you have diabetes, I talk to you once and then I don't talk to you again for 3 months. And then by the time you come back in to see me, if you even show up to see me, because 30% of people don't even show up, you don't remember what you ate 3 months ago, or, you know, how you were feeling even, you know, a week ago. But with technology, you could do little check-ins very regularly. You can hop on the call with your, you know, it's just a whole new way of interacting with the healthcare system. It's really exciting.
So speaking of that, the technology, let's say the downside, I mean, in my opinion, I think the upside is much higher than the downside, the potential downside, with respect to data privacy, you know, possible leaks, let's say. But I read this interesting article on Wired about the ads, and they were talking about this business model where pharmaceutical companies can insert ads during a telemedicine consultation, right? So they are maybe sponsoring you as a doctor, or they have some kind of an agreement. So you tell the patients, okay, use this particular medicine, and maybe an image of that would pop up on their screen.
The way that pharmaceutical companies would be able to do that is because there's a doctor practice. So they don't interact with the doctors. They interact with the business entity. And the business entity are the people that provide the platform and the technology. It's like with Uber, right? They say, okay, there's the employee, there's the workers, people that come on Uber. We don't have control over those people. We're just a platform. We're just the technology. And so that's how pharma can then enter in with the business entity and say, hey, well, we want to be able to offer ads and XYZ. But because there are so many regulations, at least in the US, in terms of interacting with doctors and influencing doctors with pharmaceuticals and all that, the doctors kind of stay separate and apart from that. What you're describing is the digitization of what already happens today. When a patient walks into the doctor's office, what do they see? They see a bunch of paperwork and flyers and pamphlets about different medications. And then there's a television screen up there and they're looking at ads for different drugs and pharmaceuticals and things. So that exists already today. And pharmaceutical companies are saying, okay, well, now how do I translate that into a virtual waiting room? So that exists. I mean, when a patient's waiting now virtually for the doctor to pop up on the Zoom or whatever, the pharmaceutical company can buy that airtime and start to put in information about a various medication or what have you. I think the smart way to go about doing that is to have it be unbranded information that is interactive video that teaches people about their bodies and perhaps how medicines work or about how diseases work, but having it be unbranded content, meaning it doesn't say, and then take this medicine. it just gives you, and like let the pharmaceutical companies work to spend all their dollars, their marketing dollars on, again, the education piece, digitizing that education. Or wouldn't it be cool if after I was prescribed a medication, I could watch a little video right on my phone on how that medicine works and what the side effects are and all that. So, you know, kind of leveraging the pharma companies and their ability to create digital assets for the greater good without having it be a message about taking a specific medicine.
But you have to somehow incentivize them to do that, right? It's like a public service announcement, almost.
Yeah, and it's also, you know, you have unbranded content about heart disease in general, and then there are, let's say, 3 major medications on high cholesterol. So they'll likely probably will get prescribed one of your medicines, you know. Right. So it's like it continuing to just educate people on things and the benefits of staying on a medication or whatever it is, that they will likely have downstream benefit of that, as opposed to maybe some of their information being discounted because it's just in the form of a commercial that seems very biased.
From your perspective, has telemedicine improved the quality of your life? I mean, we're talking about patient not having to wait in the doctor's office. What about you?
Definitely. I feel like I'm able to deliver great care to my patients. I can spend, 30 minutes, 40 minutes, undivided attention. And like I said, the doctor-patient relationship is a very special one, I think, through video and technologies and increased accessibility, that I feel more relatable to my patients. Yep. You know what? This is my home. That's your home. Great. We got to know each other a little better. And so there's a little more familiarity, nice rapport that's built. So I really enjoy the doctor-patient relationship and interaction. And then from a quality of life perspective, I don't have to leave my house. I have one baby on the way, and I have a 13-month-old taking a nap right now. So I don't have to choose between medicine and my personal life and being a mom. And so for me, that's huge, that I could still have a tremendous impact on my patients, still be able to practice medicine, which is what I went to school for a ton of years for, but then not have to give up my family life. So it's been a really nice work-life balance to be able to deliver care and not feel like I'm compromising. So I've been very happy with the career choice I've made to say, how do I leverage technology to improve the healthcare system overall? So it's been great.
Wow, this is really good. And it does allow you also to work part-time, or at least manage your load based on your needs. Like you said, you have a baby coming. So it's not all or nothing. It's completely adjustable in a sense.
And better hours for patients. I could start my day at 6 a.m. You could get in a visit before work, as opposed to, it would not be feasible for me to have 24/7 office hours, but I could probably have evening hours from 6 to 9 at night or something like that. And it wouldn't have such a, negative effect on my family and my being home. I'm just downstairs doing my doctor's visits, And so it's better for patients too, that they can interact with their doctors in this way. And they don't have to take a day off of work to go to the office.
Well, this has been great. I learned a lot, Dr. Tanya Elliott. So thanks a lot for joining us. I hope we didn't take too much of your time. So it was all right.
No, it was great. I look forward to doing this again sometime soon. All right. Thanks.
Okay. Bye-bye.
Bye-bye.
Once again, thanks to Dr. Tanya Elliott for her time. You can follow her on Instagram. This talk was made possible by Switch and Board Podcast Studios, a Washington, D.C.-based production company trying to make quality podcasting as accessible as possible. Casual Intellectual is the English language counterpart to a popular Turkish podcast/blog called Fularsız Entellik. Follow us for more English language content.